Hi guys, it's Mary with It Could Be Worse blog, and today I'm doing my Stelara self-injection number 9. There's kind of a lot I want to go over today, and I want to talk about perianal abscesses. 4 years ago, before I was ever diagnosed with IBD or Crohn's disease, I had a perianal abscess show up on my rectum. A perianal abscess is a abscess. It's a sign of infection. It's a growth, and it usually needs to be incised, and mine just happened to be related to Crohn's disease and lead me to the ER. I went to the ER and they put me in the OR so they could incise it. They gave me a bunch of morphine, and then I had to heal for 6 weeks and get a fistulotomy later, because a perianal abscess, after all that drainage is done, it can lead to a tunnel, which is called a fistula, and so you got to get that cut out so it doesn't keep happening. That was 4 years ago. We were in the middle of my diagnosis for Crohn's disease. We'd been trying to figure out what was wrong with me for over a year, and well, it came to find out that this was a big telltale for Crohn's disease, and I've been all right kind of ever since. A year ago in July, I noticed a second abscess on my rectum, and it just kind of stayed there. It lay dormant or whatnot. It wasn't doing anything. I had one moment where I went to the ER and it was draining itself, but it never really got infected like my previous one, but we kept that one in mind. I think they gave me antibiotics and told me to monitor it because I was having a fever, and it just kind of stayed the same. It was about pea size, like a pea, and yesterday, lo and behold, it started to grow and it started to cause pain, and it pretty much doubled in size, and it just felt like it was bruised. And so I'm texting my GI and telling her what's going on with my body, and she told me I could come in and see her today. So rather than go to the ER today, I went up to her clinic and I saw her in GI, and she did a fun rectal exam for me and looked at the abscess, and she knew what I was talking about. And in the past, October of last year, we did an exam under anesthesia for the abscess, but when they got in there, they said they didn't find anything. But like, lo and behold, when I got home, I still felt the abscess. Like, I know where it's at. I think they didn't let me show them where it was at before they put me under, and so they kind of went in blind. And so I tried to make a note of that. I'm going to go in Thursday morning and have another one of these done. And then after all this mess, I have to come home and do my shot today. So here I am, a hot mess. And so I just figured I would talk about that. Crohn's disease patients can get perianal disease. It's kind of common when your whole, your digestive system is filled with infection and it's targeted with Crohn's disease, but your, rectal cavity, I guess, it gets really infected. It can cause bleeding, it can cause pain, it can cause a fever. It causes the infection to lead to the abscess needing incision and then a fistulotomy. So I'm really hoping Thursday they go in there and they can just kind of figure out what's going on and not have to cut open my butthole for this third time. But, what can you do? And that's kind of why Hairy Asshole is in my scene with me today, because he was the reason I got him, was because they had to cut open my butthole twice. So that's why Hairy Asshole's in the frame today. But anyways, I'll get to my shot. I'm sorry if I'm rambling. Today has been a hot mess and dealing with that. Today I'm doing things differently. I didn't ice my stomach. I've been kind of waiting for this to come around in my cycle from the neurectomy and the rib plating. I don't really have feeling in this area, so I didn't think it was necessary to ice my stomach. I just kind of brought the Stelara to room temperature. You don't want to shake it. You don't want to do anything fun with it. You just kind of want to make sure it's good to go. I've already alcohol swabbed my fingers and my hands, so it's kind of good to go, and I'm just kind of going to get it over with. It always goes in slow, but I feel like the slower, it makes it not puffy. I know a lot of people are like, why so slow? Why so slow? It's because you bubble up underneath, and you don't want to bubble up the medicine in your stomach. And so we're going to go and see how this feels without icing it up. I do apologize today if it felt like there was a lot I was talking about and I was talking fast. I've been sitting here thinking about this abscess for days now, and it just is what it is. It's like once my body gets everything healed, like after this rib surgery, one other problem shows up. I've been all right. I knew my shot was due today, and then yesterday the abscess kind of was playing tricks with me, so I got to go in and see her today. So that was just craziness. That's how my day went. And I wanted to talk about perianal abscesses anyway, just because I've been living with this one for a year. I mean, granted, it hasn't been causing me any issues, which has been good, but I knew it was going to, you kind of expect it to do something if it's just living there. There's no reason you should have a lump on your rectum for over a year. I wish they would have taken it out last time or asked me where it was so they could find it. It's kind of hard to find when you're laying on your side, and I know exactly where it's at. So what can you do? You get the little tip into the plunger and then pull it out. And I already got my sharps container going. Sorry if I was rambling on that again. I feel like I like blank out as I'm watching the medicine go out. And so I'm sorry. Alcohol swab it again just so I can be extra clean. And then I've got my little emoji band-aids. Again, I'm sorry. I feel like I'm rambling. I get like so psyched out of my mind doing these. But I guess I'll keep y'all an update on what goes on Thursday when they go in and look at my rectum again. I hope I don't leave with a cut, but if it's going to help it. Have a good week. Oh, yours will not be as exciting as mine.